study is a longitudinal survey looking at the impact of COVID-19 on our mental health, physical health, and relationships. So today we are thrilled to present some data to you from this in our second series of the series of 5 webinars, which are sponsored by UCL Global Engagement Fund.
So in our UCL-Penn Global COVID study, we tried to measure levels of mistrust in our sample, but also features of schizotypal personality.
This isn't necessarily about the number of friends you have or the number of people around you. It's about how emotionally and psychologically connected you feel to those people in your environment. And it doesn't necessarily have to be your immediate environment. It can be people you keep in touch with through remote means.
The problem that we encounter in the built environment is that often social value, community betterment is couched in sustainability terms. And often it's the poor relation in sustainability. And what I mean by that is there are standard sustainability reports that are submitted with a planning application, but many of those don't really identify or pick up on what's required to improve certain aspects. And so the 3 areas we're now seeing being requested or provided as part of that planning process are identified in blue. So health impact assessment, social value statements, and inequalities impact assessments. But these are still relatively new in terms of requirements and in the way that they're being looked at.
Prior to the pandemic occurring, there'd been a growing interest in research on loneliness. And people were talking about an epidemic for the levels of loneliness that was occurring in Western countries. And certainly given the physical distancing and in some cases social distancing measures that have been required in order for people to remain safe under COVID, there's been a renewed interest in trying to understand the factors that are involved in underpinning loneliness and its consequences.
But the important point here about paranoia is that these beliefs and ideas about others are harmful. They think that there's a persecutory nature to these ideas and beliefs. And you can imagine if you are, going through life and thinking this way all the time, that can have serious impacts on your day-to-day functioning, and it can be quite harmful if it is persistent and sustained over time.
People are more aware of the mental health associated with where they work and their space. Now, for lots of us in the lockdown, that area of work has been our home office rather than the office. But we are demanding, I think, that when we do return to the office, that they have good natural daylight or good ventilation, or there is connection with biophilia or greenery in the office. So I do think there's a huge amount of refocusing on physical well-being and mental well-being in the places that we work, places that we play, and the places that we interact in.
And so the rationale for this particular study and the paper really is, stems from the idea of coronavirus being this invisible killer. Right? So we can't see it out in the open, and we don't know whom to trust really in terms of whether or not they are positive, tested positive, or whether they've even had their vaccines, etc. And so you can imagine that perhaps paranoia may also be instilled in us more so these days due to the coronavirus and the pandemic.
And Wan Yi?
And very simple, just to get connected with your friends and talk to them. I think it will help.